you've been in the hospital, odds are you've had an IV. Now, what you may not know is you can get IVs electively that are chock full of vitamins and nutrients, and you can do so just like that. Dr. Jonathan Curley is here from Fast Access Healthcare. Dr. Curley, welcome to Let's Chat.
Good morning.
We're going to get into exactly what's in the IV bags coming up here in a moment. As the trendsetter for this around here, you guys have seen some pretty remarkable improvements, correct?
Oh, we have. We've seen quite a few people who are now becoming more aware that you can get rehydrated faster. We've been doing this for years in the hospitals. So now electively people can come in and get an infusion with an enhanced infusion basically with vitamins and minerals and also some things that would help them feel better.
And you guys do blood work prior to the IV infusion so you know exactly what the patient needs.
Typically, yes.
All right, I got to tell you folks at home, I did this the other day and wanted you to take a look. It's quick, it's painless, and it's easy. Have a look at this.
Another ingredient that we put in there is magnesium, which is a cell stabilizer. A lot of times there's many people who are deficient in magnesium, and we do check your blood work, make sure that your levels are either optimal or not, and then we replace whatever is needed. But the magnesium actually stabilizes the cell wall, and when that happens, then you actually are able to absorb better, and any medications that you actually take will actually do what they're supposed to do. If your cell is not stabilized, it actually leaks. So then you're not able to absorb your medications or nutrients or anything else that you're taking.
I got to tell you, I learned more about vitamins during the talk with you prior to this actually occurring than I had ever thought possible. Over-the-counter vitamins like this, they just don't do the job as much as they're promoted. Right?
That's right. That's right. Although they're very effective, they can be. Mm-hmm. You get about 30% of what you're trying to take versus in
30%.
30% versus in a vitamin infusion. You're looking at 100% of the effectiveness.
Where Willie was talking about the cell walls leaking and breaking down, when you're doing the IV like this, that totally eradicates that. Now,
yes.
Tell me what kind of vitamins you actually have in one of the infusions like this.
So we're doing vitamin C, mm-hmm. which has been well studied. We know that's very, very good for your immune system. We do a multi-complex vitamin along with B12, mm-hmm. and we're also using something called glutathione, which is one of the most natural, ultimate anti-inflammatory elements that you can get.
Who most benefits from a vitamin infusion like this?
Well, typically just rehydrating is a real benefit, mm-hmm. because most of us walk around dehydrated.
Sure.
We don't drink our typical 2 to 4 liters of fluids every day that we need to, or
right.
water. Plus, with our demanding schedules, and drinking obviously coffee and things that will as a natural diuresis. So we're typically underhydrated.
Now, athletes have been doing this for a long, long time with
That's right.
obviously some pretty amazing results.
That's right. Because of the recovery process after a heavy workout, especially the folks who are doing very demanding sports. They've known this for quite a while, mm-hmm. because when they finish a sport or say a run, like here in Chattanooga we have the Ironman, right? You're depleted because you are sweating and you're losing a lot of these nutrients quickly. So the design is to replenish this. So people who are not necessarily a professional athlete, but who have chronic inflammatory issues, mm-hmm. Or dealing with chronic inflammation of some sort, chronic fatigue, they can benefit from this very well.
I'm going to steal a few extra seconds and ask you 2 very quick questions. Is there anybody that shouldn't take an infusion like this?
Absolutely. There's no perfect medicine, as we've discussed before. Mm-hmm. And so people with heart issues, such as congestive heart failure,
right.
Or kidney disease, dialysis or things, people who cannot handle an influx of fluids
right.
should avoid these items. But for the typical average healthy person, absolutely.
Takes about an hour?
Takes about an hour, that's right.
And I got to tell you, it does make a difference. Concentration's better. It'll
that's
help
right.
you sleep better.
That's right.
And it's not a one-stop fix-all like you said a
that's
moment
right.
ago, but I think you told me that you got to understand basically your body's a machine. It's not going to run properly
right.
unless it has the right kind of fuel.
That's right. We're just trying to enhance your immune system and give people the ability to perform better.
How does this work in relation to fighting the flu?
Well, in the the flu is pretty taxing. We've seen a substantial increase this year at all of our clinics.
Right.
So when people are fighting and their immune system is taxed, and they may not be drinking enough fluids, they'll get dehydrated. And so what we're seeing is we're trying to help rehydrate and then put some things back in that are natural elements that can help them fight this.
We will have you back over the coming weeks and talk more about that. You can find out more about Dr. Curley and the great staff at Fast Access Healthcare. They got 7 locations around town. Again, fastaccesshealthcare.com. The website, one more time, fastaccesshealthcare.com. We have much more of Let's Chat right after this.